I will be performing the manual muscle test for interphalangeal or IP flexion of the thumb. The muscle responsible for this movement is the flexor pollicis longus. The origin of this muscle is along the mid-anterior surface of the radius. The insertion is on the volar surface of the distal phalanx. The innervation for this muscle is the median nerve C7-C8. The client should be seated in a chair with their forearm supported by a table. Their forearm should be in supination and their wrist in neutral. The metacarpal phalangeal joint of the thumb should be in extension. The therapist should be seated next to the client and should stabilize the client's MCP joint to prevent movement. Next, give the following instructions to your client. Bend the end of your thumb downward and hold it there. Don't let me straighten it back up. The therapist then uses their other hand to give resistance on the palmar surface of the distal phalanx of the thumb and applies the force in the direction of extension. For a grade of 5, the patient is able to take maximum resistance. A grade of 4 will be able to take fairly strong resistance before breaking. Because the hand is already placed in a gravity minimized position, a grade of 3 will require the client to not only complete the movement, but also to take minimal resistance. Once again, there is no alternate position for gravity. A grade of 2 requires the client to complete the full movement, but not to take any resistance. For a grade of 1, palpate the tendon of the flexor pollicis longus on the palmar surface of the proximal phalanx of the thumb. Any trace movement will result in a grade of 1. If no movement can be palpated, the client will be given a grade of 0 for IP flexion of the thumb.